Major cuts to Medicare and Medicaid have been signed into law in 2025 through the One Big Beautiful Bill Act. This legislation threatens coverage for millions by slashing funding and stripping health insurance from low-income individuals, older adults, and those with disabilities. The nursing professor, Dr. Shelia Spurlock, breaks down the critical differences between Medicare and Medicaid, then pivots to the real-world impact of proposed budget cuts, highlighting services often overlooked in mainstream coverage. It's not just about numbers. If you're older, living with a disability, or on a limited income, you could lose access to home health visits, long-term care, medical transport, or other equipment you rely on.
Hi, it's the nursing professor here. I want to take a moment to share with you some of the other programs that are covered by both Medicare and Medicaid. Frequently, we hear of all the discussion in the news now about possible budget cuts to Medicare and Medicaid and wonder how that is going to actually affect our hospitals, which are considered acute care stays. Well, when we talk about Medicare, we're also talking about coverage for people who are disabled. It's not just for the elderly over 65. In addition to that, Medicare benefits, like Social Security benefits, have been previously earned and money has been placed into an account called FICA, F-I-C-A. If you have a job, take a look at your pay stub, you'll see FICA. That is money that has been allocated to help take care of you when you are ready for retirement. And so that's how you get a Social Security benefit check. That's how you become eligible for Medicare. So it's not a government giveaway. And sometimes it kind of sounds like it is, and it really, really isn't. All right. So remember, Medicare covers over 65 and people who are disabled. All right. It's also going to cover you if you need subacute rehab, because many times people get injured, they go into the hospital, acute care setting, and they still need more. Still need more physical therapy, occupational therapy. They may need daily IV antibiotics, and they go to what we know as subacute care. With these are places that are typically in long-term care facilities, but there's a wing allocated for that. They stay there for usually a week, 2-3 weeks until they are safe to go home. You know, you have to think about it. Sometimes people who have knee replacements, hips replacements, they live alone and they have steps to their home. And so it would not be a safe discharge to send them directly home. So they will go to what we know as a subacute stay facility. It also covers those people who are on dialysis, who have end-stage renal disease, and without dialysis, they will die. All right, so that's both hemodialysis and peritoneal dialysis. It covers hospice when we're at our end of life and we want to make decisions about what we want without care or not. And some people want end of life care. They don't want all of the heroics. It covers also your durable medical equipment, like if you need the walker, the cane, the crutch, those types of things once you become eligible for Medicare. And it covers many of your products like wound care products. If you have a really bad wound and you need gauze and tape and ointments and creams and all of those things, it's covered underneath Medicare and the durable medical equipment portion of the policy. And that can cost you a lot of money. All right. So next I want to clarify about Medicaid. Now, Medicaid typically is income based. And so it's for people who make a certain level of income or no income at all, and it does provide health care coverage. It can also cover people who are disabled, young people who are disabled, because how are they going to be able to get health care? You know, so many times we have children who are born with disease processes or disabilities that make them meet Medicaid requirements. All right. So Medicaid is the primary source of nursing homes. So for all the people who need to go into nursing homes, like people with dementia, Alzheimer's, people who can't care for themselves, maybe they have no other family to help take care of them, then if they elect to go into a nursing home, it's covered by Medicaid, not Medicare. And most people do not have enough money to pay for nursing home services out of pocket. Nursing home services at this time cost anywhere from $10,000 to $15,000 a month because it provides 24-hour nursing care. And so most people, upon retirement, don't have that type of money to take care of themselves. It also helps to pay for co-payments and deductibles that Medicare does not pay for. So I just wanted to make sure we're clarified as to what we're hearing all in the news about Medicare and Medicaid cuts is that it's just not hospitals. We don't have to just worry about hospitals closing, but we need to be very concerned about these other services that could possibly go away as well. So I hope that helps. I will see you next video. Bye for now.